Now, who is going to suffer from the breast cancer? The statistics, I am sure, with due respect, would have scared you all, especially the females. But this picture is not that scary. Picture can still be better, provided we understand the pathogen, the evolution of this disease, and the precautions to be taken to prevent it or even to diagnose it very early. Having said this, which kind of females, women, are more subject to this breast cancer? You might have been aware and heard, and also through various sources, that nulliparous, that is childless or women, and then women who wouldn't suckle their babies, devoid of breastfeed and all that, and then those who have had hypertension and overweight, obesity, and also family history are some of the women who are called high risk for breast cancer. And two factors we have definitely seen over a period of last 50 years as far as the cause of breast cancer is concerned, or let me put it, the high risk factors. One is obesity, second is strong family hereditary aspect of it. That means it does run in families. So breast cancer is one disease like so many other cancers which runs in families. So a family history of breast cancer and obesity are the triggering factors, and they ring the bell. That's where one has to be cautious, and I'm sure all the family physicians are also were updated would suggest to their female patients about, if at all they find the risk factors, to be very careful. Having said this, to be careful is nothing but to have a regular checkup in the form of self-examination of the breast, and then consulting your family doctor or even the surgeon or oncologist or a gynecologist for periodical mammography and ultrasound scan of the breast, which is a very simple procedure. Generally, mammogram is advised after the age of 35 in normal individuals, but in those cases where they have a strong family history, from the age of 26 onwards, a mammogram can be done as a baseline, and every 10 years it can be repeated in the normal individuals, and once in every 5 years in the case of high risk individuals. This is the only way to diagnose the cancer early, God forbid if one is developing it. Now, the family history means not only the mother and the siblings, but also the first degree relatives like grandmother and then first cousins. These are all the aunt, paternal aunt, maternal aunts. These are all the first degree relatives who also influence the genetic that provoke development of cancer. So these high risk individuals, as I narrated, have to be careful and they have to be periodically screened for any development of breast cancer. Apart from breast cancer, the genetic germline mutations, what we call, which are inherited, the germline mutations also influence a series of these cancers, including breast, ovary, endometrium and colon. So there is a set of females who develop endometrial, that is uterine, breast and or colonic cancer, unfortunately, and these individuals are influenced by genetic mutations which are carried forward through what we call driving mutations or driver mutations in the genetic inheritance. So the acquired factors, as I narrated, and then congenital or the inherited factors, as I told you, are the ones which influence genesis of this cancer. So once somebody is at high risk as per the genetic background and also the other factors, regular checkup is one which influences the early outcome, and also the 5-year survival, 10-year survival and longevity, cure rates following any kind of treatment for a breast cancer also depend on the stage. As you all might be aware, the earlier the stage of the cancer, the better the outcome of various types of treatment that are available for breast cancer. While abroad, like countries like states where a lot of influence is generated about the evolution of the disease, the risk to life in the females, the cure rates are as high as 90%. Of all the stages, of all the ages put together, they are having about 86 to 90% of 5-year survival, 10-year survival following treatment. Whereas in India, I am afraid it's not more than 46%. The 5-year survival, 10-year survival of breast cancer's outcome following various types of treatment is not more than 46%. So you can see the difference. That's why the emphasis is on what is called preventive aspects and also the early diagnostic aspects. So because the patients are diagnosed early there abroad, probably they could do more meaningful, effective treatment, bringing out better cure rates and a long-term survival in the breast cancer afflicted individuals. Mind you, one thing here, breast cancer can also affect males. So breast cancer can occur in males as well. About 3 to 5% of all the breast cancers are seen in the men. So breast cancers, when suspected, should be properly evaluated even in males.